So thank you very much. Good afternoon, everyone. Delighted to have an opportunity to chat to you just for a few minutes about some of our experiences of interdisciplinary work as part of this collaborative doctoral award in youth mental health leadership. Maybe just to say, when we started this out, what was really exciting about this was an opportunity to work with terrific colleagues in the area nationally to carry out research across three broad pillars focused on epidemiology, focused on barriers to accessing treatment, and focusing on developing and then evaluating novel treatment. What made it a terrific experience, however, was the really terrific bunch of trainees that we had onto the program, which came from psychology, from psychiatry, from occupational therapy, and social work. And we had an additional colleague from the ICAT program who joined us as part of the training as well. And so over the 5 years, we've had a lot of time to think about what's worked well and what hasn't. But mental health research and practice in general is a terrific testbed for interdisciplinary work. Somebody talked earlier about the variety of languages that are involved, and mental health can feel a little bit like a Tower of Babel, you know, where everybody brings their own perspective, brings their own language. And what's a little bit unique about mental health is we vie between biological explanations, psychological explanations, and social explanations. So there's a great opportunity to, you know, have differences of opinion and not get along. In terms of why that is, well, partly it's because we're all trained differently. We're all trained in isolation from each other. It's also partly, I think, because we work in an area which is, you know, perennially underfunded, and so we're all grasping for our own little part of the pie. Also, though, it's because we all think we're right. We all think our perspective, a little bit like the 12 blind men and the elephant, that our perspective is the correct one, and it's really about convincing our colleagues that that's of how much we're right. I always thought this was for historical reasons, but I had a really interesting opportunity to travel to do a needs assessment in Addis Ababa University a couple of years ago. And I went down to talk to the School of Psychology, and I said, you know, if there was one thing that you needed help with, what would it be? And they said, well, what we'd really love some help with is to start a clinical psychology program. And I said, oh, it's really interesting. Have you spoken to the psychiatrists who are running the clinics? And they said, yeah, it was a waste of time. You couldn't talk to those guys. So the next day, as it happened, I went to do a similar interview in the Department of Psychiatry. And I said, if there's one thing you really want to do, what would you do? And they said, what we really need is training for therapists in our clinics. And I said, that's really interesting. Have you considered speaking to the School of Psychology guys? And they said, oh, we tried. You couldn't talk to those people. And I was really interested that just in a few years, those, you know, disciplines that were only 10 years old in Ethiopia had recapitulated 100 years of antipathy that the rest of us had. So when we started this program with some what we thought were really good ideas about how you might change this. We had to put a lot of thought into the training program. It was going to consist of bringing the group together by themselves, not as part of the Sphere program, but really wanting to kind of hothouse them with a number of modules that were bespoke, a number of workshops, a number of international placements, national placements, and so on. And notwithstanding, you know, COVID that we all know about, so I'm not going to even bother talking about that, there were some really great opportunities for us to bring people together. We also put a lot of thought into the management plan, where alongside the kind of more traditional university structures of the supervisory relationship, the research committee relationship, we wanted to foster the learning via a research training committee where we'd all come together once a month and talk about what was going well, what needed some work, and also an executive program board, which was really a stakeholders group and which was a really excellent experience. We were also very much informed by the national framework for graduate skills and attributes. And we really wanted to move beyond just doing research skills, but also thinking about communication skills, teamwork and leadership, and entrepreneurship and innovation. Very much, you know, we thought kind of very much what the HRB was asking us to do in terms of the value of building future leaders in this space. But over the 5 years, we've really had to think about, well, what does multidisciplinary or interdisciplinary work look like? And one of the trainees came up with this analogy that I thought was really helpful. She said, well, multidisciplinary is where everybody stays in their own lane. So imagine you're putting together a program grant, so you slot in your program section, somebody else does their section, and then somebody reads the whole thing and sends it off. So everybody's staying in their own lane. By comparison, interdisciplinary is a little bit more like a fruit salad than a fruit bowl, where you're really trying to work on each other's projects, and you're trying to fit alongside each other and intermingle the expertise. And what the trainees really valued was moving beyond interdisciplinary to transdisciplinary, the kind of idea of a smoothie where you, a little bit like mammalian biology, you didn't just focus on the 0.5% of the genetics that was different, but the 99.5% that was commonalities. How did that work in practice? Well, at the level of cross-teaching, it was a really terrific experience. So we, as I mentioned, we had this kind of bespoke module approach where we talked about all the various perspectives on youth mental health, and then got the students to come together and do a series of case studies thinking about and adding their own perspective and learning from each other. And the trainees, and I have to say myself personally, we really enjoyed this. One of the things, stuff that you don't even think about, like I remember Neil, one of our trainees, saying he always wondered why medics started with blood tests. Like if somebody's coming in and they've got, an experience of depression, why would you bother with a blood test? And David, one of the psychiatry trainees, was saying, well, if you're a medic, the first thing you learn is to rule out the stuff that can kill you. And that was a really interesting perspective for some of the people in the room to have. So there was great opportunities to do really interesting work around that. There was also opportunities to get it wrong, and I just want to give you one example of that. We had a series of 8 workshops planned across the program, 4 that were going to be led by the PIs with support from the trainees, and then 4 that the trainees themselves were going to lead on, very much in that idea of developing leadership skills. And the first one of those was to organize a workshop on the theme of youth mental health and social media, something that was still very topical, but very topical at that point. But giving the trainees an unstructured task led to role ambiguity and role conflict within the group. And when we did a reflective practice session afterwards and give the trainees a chance to think about it, they were really great, because they said, well, the first thing we did was we all reverted back into our silos, I started to think like a psychologist, somebody else started to think like a social worker, etc. And also other aspects of our differences came up, differences in age, leaving the older trainees to speak, and differences in gender, which I thought was very, very interesting. By comparison, my colleague Susan Smith, who led one of the other collaborative doctoral awards, gave what I thought was a terrific example of getting the trainees to learn from each other in a very interdisciplinary way. So the example was of saying, well, there's many projects have a range of methodologies that are going to be included and involved, and it might be useful, for example, to have a psychology trainee working with a health economics trainee on a study of financial burden and multi-morbidity. So really getting them to learn between themselves. And I put up that picture of Vygotsky because he's one of the really great thinkers in this area, where if you think about primary schools now, where the children's tables all face each other rather than facing the teacher at the front of the class, that you're much more able to learn from the person who's 6 months ahead of you in one particular methodology than somebody who's 20 years experience and might have forgotten what it feels like. Other feedback, just 6 very, very simple points. We started off seeing ourselves independent from Sphere, and we really thought in retrospect there might have been perhaps more opportunity for complementary synergistic activity between the two. PPI, funny to say this, but this became a real bugbear in the group. Back when we started in 2018, the HRB were really only starting to talk about the importance of PPI. Now 5 years later, everybody, I think in this room probably gets that. But there was a lot of disagreement when we did our first project on, our first workshop on PPI with Adele Murphy from PPI Ignite, about so whose job was PPI? Who should it be part of every project? Should it be a standalone project? And there was a lot of discussion about that. The third point was about when do you bring both the more junior colleagues and the more senior colleagues together. And I think a mistake we made was not doing that early enough right from the start. Another tension was including going from the more traditional PhD, which is about getting the papers out and learning the methodologies, to really becoming a leader in a broader sense of the world, where you focus on your skills in innovation and communication. And then the sixth point that I thought was really, really good, get everybody to read all aspects of the program before you start. So what was very clear was everybody was really expert on their own little bit, but having at the start an opportunity for people to come together and identify the points of engagement. Once you've started, sometimes that can be a little bit tricky. I just want to conclude by saying, for me personally, this was a terrific opportunity. I had just done, mainly biological research via my European Research Council funded work. This is a terrific opportunity to think about a different type of impactful research, not just about scientific publications, but about doing something that was going to have more of an impact at the level of services, and that's been a really great stepping stone onto HRB Leaders Award that I'm not going to talk about today, but it's been very, very meaningful. So in conclusion, I'm really, you can talk about interdisciplinary work as glass half empty or glass half full. My perspective on this is that my perspective really grew while I did this. I thought it was a terrific opportunity to learn from other colleagues, and I think anybody else on the program would probably say the same thing. So I want to just conclude by thanking the many, many people who've ended up becoming part and parcel of our program, chaired by the Children's Ombudsman, Niall Muldoon, the great group of trainees, the great group of PIs, our youth advisory panel, which I've really enjoyed participating in, talking and consulting and learning from the family representatives of ULEAD, and also the clinical stakeholders. Thank you very much.